Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Hammad Shah. He's CEO at Clarest Health. Welcome, Hammad.
Thank you very much, John. Thank you for having me also. I really appreciate it.
Yeah, excited for our discussion today. Lots to talk about, but before we go there, tell us a little bit about yourself and Clarest Health.
I'm a pharmacist by degree. Worked first decade of my career in retail, another decade in the PBM industry, and for the last, I'm old, you can tell, right? For the last,
No, I can't. You look
for
good.
the last decade, I've been really trying to be with organizations where we can disrupt healthcare, improve things for patients and providers, and that's what Clarest Health is about. So we are a med management organization. We really focus on making sure that the patients have the right medication, the optimal therapy. We want to make sure that the outcomes are what they should be. And there's a connectivity issue between the patient and the provider. We're trying to solve that. We're trying to cover these gaps that exist in healthcare today.
Wow. You know, I recently saw a patient. She had a bubble for every medication she took, and the thing was just full. And she's like, and I have to manage that. But what do you see as kind of the biggest challenges with medication management today?
Look, I think, great question. I think one key challenge is that there's lack of coordination with the providers. The patient gets into gaps. So if they've got comorbidities, they've got a neurologist, nephrologist, cardiologist, and it's impossible for all of those physicians to really coordinate therapy. And the patient actually is being led in silos, right? The other issue that I see is the services that are provided for that patient, let's say pharmacy, for example, are transactional. There's no one that's following that patient. If you look at that patient, and as we age, we see patients going from their home to a nursing home, to a hospital, maybe rehabbing in a nursing home, going back. Who's tracking all that? Who's that advocate? So all of these gaps lead to adverse events, they lead to suboptimal therapy, and they lead to reduced outcomes. So those are some big things that I see.
Yeah, and you're right. They're not coordinating care between specialties often. And, you know, I think the other thing that I see on that is they're going to multiple pharmacies. Like, I remember one of the first times I started working in healthcare, the pharmacist said, you should only go to one pharmacy. And I'm like, why? I'm going to the cheapest one. She said, but then they can't coordinate your care. And I think that's gotten worse over time. Is that what you've seen as well?
Absolutely. It's not just that they're going to different pharmacies. They're using their prescription benefit in one, they're paying cash in another. And because some pharmacies tout the fact that you can get generics really cheap.
Right.
So there is a real issue in terms of coordination. And again, the patient, especially as they're aging, the caregiver for that patient and that patient are unable to really navigate that process. Something needs to happen in that space, and we hope with the tools and services we have that we can be that advocate.
So talk to me about that. How can healthcare organizations use population health data, predictive analytics, other technologies and data to improve medication management?
Look, I think that compliance is key. So really understanding those patients that may be non-compliant and making sure that you help them get compliant. That is a big piece that a lot of folks are focused on right now, and I think it'll produce great value. Because if you think about the experience that the patient has with the physician, that experience is short and also transactional. If they're not taking their therapy in the 30 days or 60 or 90 days before they saw the physician, what's a physician going to do? They've got some acute measures they can take, but it's not helping that patient. So adherence is an issue that needs to be tackled. I think another issue that needs to be tackled is the mix of meds. We talked a little bit about it already. People are incentivized, and I'm a pharmacist in there throughout all different areas of pharmacy. Through most of my career, I was incentivized on filling more scripts.
Yeah.
Right? Wherever I was, come on, how many scripts did you fill? Well, maybe they need to be on less meds, but the right meds. Not enough people are doing that because the incentives are wrong. So, and the last thing is really thinking about adverse events.
Okay.
There are a lot of re-entries into hospitals because patients have adverse events to the cocktail of meds they're taking. And if we can attack those three things, I think we will be much further along in terms of optimal care.
Yeah, what a great framework. You have a product called MTM Path. Talk to us about that. What is the product? What does it do? What does it offer?
Well, it's a great way for us to take analytical data. So we have pharmacy claims data. We also have data on diagnosis codes for that patient. What is the comorbidity that patient has and why are they taking medication? We couple that with live interviews with that patient and do a complete medication review. Now that we've done a complete medication review and we have the back-end data that I talked about, we pull that together and risk stratify that patient population. What we're attempting to do is to say, okay, John's on 2 meds. He's got a cholesterol med, he's got 1 other med. You know what, there's not a lot of downside here.
Sure.
He's gonna be okay. But I've got this other patient here that maybe is on 10 meds and their risk for rehospitalization, a bad outcome, is much worse. And if a payer looks at that cost scenario, they'll see that the potential for something to go wrong is much greater in that population. How do we risk stratify that patient and how do we make sure their therapy is optimal? So focus your guns on where you're going to get the biggest benefit with which patient population. MTM Path really helps us do that. It helps us do that analytically instead of pharmacists trying to figure it out. And it is a great tool for us for not only giving us all the data and putting it together, making sure that we ask the right questions because the data feed is before we have the interview. So we have a good feel for what to ask.
Okay.
Then on the back end, it pushes out the algorithm, using algorithms, what we should do in terms of risk stratification and how should we target that patient? What's the issue that patient could experience? So it's a tool that we have developed internally using pharmacists, and it's really helped us take in a tremendous amount of data and make decisions much faster.
Interesting. You've talked a little bit about the fact that, kind of this evolution. It used to be fill scripts, which in some ways it kind of is to some degree too. But we are seeing a shift to value-based care as well. What role does medication management solutions play in value-based care, and how can they scale to the challenge? Because it is a big problem, and every healthcare organization has limited resources. So how do you see medication management playing with value-based care?
I think MTM Path is a key piece in the play because you just talked about it. It's a big problem. There's a lot of patients impacted and there's a lot of data swimming around.
Yep.
So you need a tool that will help you take the input and then use the algorithms to risk stratify and say, where should we target the problem? Where is the problem? Where is the biggest bang for the buck? And where should we go after? It's like a Pareto. You get the biggest problem first and then you work your way down. Organizations that are participating in value-based care need those kind of tools to be able to risk stratify that population and target it effectively. Then it's the same stuff that I've said all along. You target the adherence, you target the mix of the drugs, you really make sure that you're reducing adverse events. All of these things are increasing the cost. What we see is a lot of payers and providers are entering into value-based contracts. I think that's great. It's really starting the momentum away from fee-for-service. The fee-for-service model I'm not a huge fan for because it's, again, transaction,
Sure.
right? So the momentum is there. What folks have yet to realize is once you get the trend line to where it should be, you still haven't hit the management of meds. We think we can bring that trend line even lower by using effective med management. So I think we play a big role in value-based care.
That's awesome. And as you do it, right, it's one thing to say, okay, let's do some medication management, but what are the keys to doing it right? Is it about having the right data, or is it about good algorithms, or I guess we have to say AI, or it's not a health IT discussion. But
you got to squeeze that in somewhere, right?
Yeah, it feels like right. But is it about the data? Is it the algorithms, the AI? What's the key to really doing it right?
Yeah, so I don't think it's any one thing, okay? We at Clarest Health have separate divisions. We have a long-term care division called Remedy Senior Care. We have another division that's focused exactly on these tools that are AI focused, where MTM Path falls under that umbrella. We have another segment of our business where we actually have that pharmacy where we fill patients' medicine and send them home. we call that care fill. So we've got these separate pockets. I think all of those are really important. Organizations are doing piecemeal today. We wanted to put all the tools together and the capabilities together to say, how can we be a full service partner for those patients that need it most and for those payers and providers that are looking for that assistance? It's coordinating all of that and pulling it together. That's what I think we are able to do, and those are the gaps that we need to bridge today.
That's awesome. So where's medication management headed next? What do you see kind of on the future roadmap?
I see better information sharing. I see payers really looking at the things that we have just talked about and said, look, there is value here. If we share effective data so our MTM path tool can be more robust and have the right data in it, that will allow those patient interactions to improve. More data, better interactions, better questions. Then the risk stratification, there can be a combined strategy where it's not just the analytics, but it's also the high touch that we provide, coupled with, I think one of the big issues is that if you look at how patients' compliance is judged today, it's judged by, if you went to a CVS or a Walgreens, did you pick up your script? Well, if you picked it up, you're compliant, John, right? But
maybe.
Nobody knows. Your cabinets are full with the meds, and you don't know which ones to take. So I think we need to change the definition of compliance. We have a high-touch model where we are actually interacting with that patient and validating that they are taking those meds. So it's pulling all this stuff together. That's where it's headed. And our goal is to, it was initially, is to build all these capabilities or purchase them and put it under one model. Now I think we've got that. And we are better prepared than most organizations in the marketplace to be that patient advocate.
Yeah, my favorite solutions out there are ones that combine like multiple avenues.
Yes.
In this case, you have data, you have algorithms for risk, you have communication and all the accessibility to patients to be able to communicate with it, and combining it and packaging it in a way that you can improve medication management. What a powerful idea and powerful solution.
Thank you. I think it's the evolution of med management.
Yeah.
We feel we are the next evolution.
Awesome. Well, Hammad, I appreciate you taking time to sit down with us and share about what you're doing to help improve the lives of patients. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, Hammad.
Thank you again. I appreciate your time.